Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast discusses two articles of JAMA. Both are phase 2 randomized trials targeting Lp(a). Lp(a), lipoprotein A, is a genetically determined causal risk factor for atherosclerotic cardiovascular disease and aortic stenosis. Traditional lipid-lowering therapies like statins, PCSK9 inhibitors have limited effect on Lp(a) levels. Novel therapeutics for Lp(a) reduction include Zerlasiran, a small interfering RNA, targets hepatic synthesis of apolipoprotein A, administered subcutaneously. The second one is Muvalaplin, an oral small molecule, inhibits assembly of Lp(a) particles by preventing ApoB binding. Zerlasiran phase 2 clinical trial findings, study design. They studied 178 atherosclerotic cardiovascular disease patients with an Lp(a) levels of greater than 125 nanomoles per liter. The Lp(a) reduction at 36 weeks with 450 milligrams given Q 24 weeks was 85.6%. With 300 milligrams given Q 16 weeks, it was 82.8%. With 300 milligrams given Q 24 weeks, the reduction was greater than 81.3%. Safety, well tolerated, mild injection site reactions, 2.3 to 7.1%. Conclusion, effective in lowering Lp(a), phase 3 clinical trials are needed. Muvalaplin study designed 233 high-risk cardiovascular patients with an Lp(a) of greater than 175 nanomoles per liter. The Lp(a) reduction at 12 weeks with 10 milligrams per day was around 47.6%. With 60 milligrams a day, it was around 81.7%. With 240 milligrams per day, it was around 85.8%. Safety, no major concerns reported. Conclusion, first oral therapy for Lp(a) reduction, long-term trials are needed. This is in a nutshell, two phase 2 clinical trials with Lp(a) reducing agents.